Hi everybody, it's Anthony Lowe, the physio detective here. I've got the girl doing the overhead squat, that's my picture in the bottom corner, and we've got
Mhm.
Christy Natali with us. Hi Christy, how are you?
Hi, good.
Awesome. Now, what we're going to talk about today is femoral head centering. So, I just wanted to start by talking about what femoral head centering is. It's a very biomechanical term. Um, and basically, I describe it using biomechanics and mechanics because it's easier for people to understand. But ultimately, we're just trying to mess with the brain here again and trying to change coordination patterns so that we can get muscles to work. Um, the bottom line is that the femoral head is essentially spherical, and the acetabulum is essentially spherical. So there's not a lot of room to move. In fact, the amount of room to move is millimeters, if that, which is very, very small amounts. Um, However, we can see that there's been some research which shows that you can have different wear patterns in the femoral head, especially if they look at things like hip replacements and stuff like that. They can see different wear patterns, and they think that it's because of the balance of the muscle control around the hip. So, trying to balance all of that out is what we're trying to do. So, the whole idea is to make um, the the femoral head work in a different way so that it doesn't want to go forwards and through the labrum, rather stay centered in the socket so that you don't get things like TFL and your hip flexors firing up excessively just because they feel the threat of maybe you might dislocate. So that's what today's all about. Did you have any questions about it, Christy?
Nope, I'm ready.
All right. Um, so the first principle that I want to show you that relates to this is how the brain coordinates everything. So if you just sit back a little bit there, Christy, what I want you to do is just touch your nose for me, please. Awesome. Now, did you have to think about every muscle, the biceps, the deltoids, the finger, where your finger was in space? Did you have to think about all of that?
No.
No, of course not, because all you thought about was touching your nose, and you happen to use your index finger, I think. But if
Hmm.
I asked you to use your little finger to touch your
My
nose,
little
yeah,
little finger?
your little finger.
Okay.
There you go. Okay, and so the only thought that you had to think about was little finger to the nose, and the brain works out everything else. And that's the fantastic part about our bodies. If we had to think about every single action and reaction, we never really would get anywhere because it all happens so fast, our conscious brain can't keep up with it. So, all of our balance, all of our coordination, all of our muscle activity, even though we do special exercises to train these muscles so we think, what's really happening is that it's all going on in the background without us knowing about it. So that's the kind of principle that I want to try and utilize when I try and teach people how to do these femoral head centering um, activities and just changing the movement patterns that they have. So the summary is we're going to mess with your brain now using words, which is awesome because if I can make a change and I'm sitting here in Sydney and you're sitting there in Washington State, well, I think that's pretty incredible. Okay,
Yep.
let's get you to move towards the door for me. Thanks, Christy. So you're
Sure.
going to have to move your camera. You might have to tilt the camera down a little bit for me, Christy. Yeah, there we go. Did you change into your Seahawk shorts?
I just changed into shorts that would go with my shirt.
Oh,
Not
okay. You're not a Seattle Seahawks fan, are you? Not at all.
at all.
All right. How about we use your right hip? Are you comfortable using your right hip?
Yes.
Okay. I'll get you to turn to your left. That's the way. Now, Christy is a physical therapist. She works with kids, so I'm going to use just abbreviated terms because it's faster. So Christy, just grab a hold of your greater trochanter for me, thanks. Awesome.
Grab a hold.
Yeah,
There it
that's
is.
it. So So that isn't really how wide the greater trochanter is. You know, obviously there's skin, there's a little bit of fat, there's muscle, there's attachments, there's things like that. But that's essentially where the greater trochanter is. Now, Christy, just bend that knee a fraction for me and then adduct and internally rotate.
AB duct.
Adduct. Yep. So when the knee goes in, that greater trochanter will come around as well, and that's what you can see happening there. And when she stands back up or brings the knee just back out, the greater trochanter moves as well. So in that motion of internal rotation, you have internal rotation at the femoral head, and the greater trochanter sits relatively a fair way away from the axis of movement. So it actually moves more the further out that you can hold on to it, just because of physics. So I'm sure you all remember physics and mathematics, and the longer the radius arm, the more movement you'll get, but the same amount of degrees of rotation. So what we're going to do is now I want you to put your right hand on your ASIS for me, please, Christy. Awesome. Yep, so you can see that her thumb is on the back of the iliac crest there, and she's got her middle finger on that ASIS, which is fantastic. Now, the ASIS is the very top of the pelvis. Can you put your hand on your pubic bone for me anteriorly, please? Yep, that's the pubic bone there. So can you use your right hand for ASIS and left hand for pubic symphysis, please? And can you get the front of that ASIS for me? Thanks. Okay. Now I need you to rotate just a little fraction to the left for me, I think. Yep, not even that much. So go back, go back, go back. Yep,
Okay.
right about there. So look, it's very difficult to tell on camera, but it may be that Christy is in the very slightest bit of posterior rotation. So just relax your bottom for me there, Christy. Yeah. And just do a posterior tilt for me, please, Christy. Yeah, so there wasn't much posterior tilt there at all. Do an anterior tilt for me. Right. So, Christy, I just want you to find the most anterior, maybe even the inferior part of the ASIS for me, because I'm not seeing it move the way that I would expect.
Okay, it's under my middle finger. My middle finger is underneath it.
Okay, cool. I just want you to travel with it when you go in your tilts for me, and it could just be the
Okay.
video. So, posterior tilt, that's better, and anterior tilt for me. Awesome. Okay, so that anterior tilt is, and go posterior. So you can see that Christy doesn't have much posterior tilt there, and anterior tilt for me, please. She's got a lot more anterior tilt. That tells me that she probably sits in a degree of posterior tilt. So just sort of let the weight of the ASIS fall forwards just a fraction for me. Yep, that's plenty. That's too much. Yep, that's good there. Now, one way that you can check to see if you're in posterior tilt or not is to do the anterior pelvic tilt and posterior pelvic tilt. But I want you to just use your right middle finger on your hip flexors for me, please, Christy. That's it. Are they hard, soft, or generally okay?
Firm, I guess.
Yeah. Okay, now go into posterior tilt for me. How do they feel now? Or lean backwards.
Uh,
Do a bit of a
what?
lumbar extension.
Lumbar extension?
Yep.
You want me to extend?
Yeah, well, I want you to lean backwards and extend your hip and your back a bit. Extend your hips. So posterior tilt as well. Yeah,
Oh, okay.
yeah. How did that feel?
Kind of strange.
Uh-huh. How's the hardness of the muscles there?
A little bit more.
Yeah, okay. Now that's what they're supposed to do. These muscles are meant to stop you from falling over as well as pick up your leg, of course. So I want you to relax again. Now I want you just to go into anterior tilt, but try to do it as passively as possible. So don't force it. Don't force it from your hip flexors. You know, sort of use your back to sort of do it. You can even bend forward a bit. I don't mind if you lean forward. That's it. What happens to those hip flexor and TFL muscles?
They relax.
Good. That's the correct response. Okay, so you know you can't see on video, but it doesn't look good. We're not going to keep you here. This is not where I want you, but I want you just to see that different postures lead to different reactions in your muscles. Okay,
Hmm.
just stand normally for me, Christy. All right, just use your right hand and tell me how firm or relaxed, activated your glutes are, your TFL, and your hip flexors.
Not very.
So that's good. So the glutes aren't very activated right now. We'll say activated as opposed to firm.
Yeah. No.
How's your TFL?
TFL.
So up and a little bit forward of that.
It's working a little bit.
Yeah. And your hip
Yeah.
flexors.
Also working a little bit.
Okay. Now what I want you to do, Christy, is I want you to put your left hand over your sternum for me, please. Good. And your right hand just over your pubic bone, as far onto the bone as you can. Tell me. Yeah. Okay. Now I need you to rotate very slightly, like 2 degrees to your right for me, thanks. Yeah, that was a lot. That was like 5 degrees. Yeah, okay. Oh, not even that much. There you go. That's good.
Okay.
Cool. Okay. Now you can see here that Christie's chest is very marginally, very marginally posterior. Now it's hard to tell because of parallax angle. Much better done in person. I want you just to relax the bottom of your ribs and let them sag down towards your pelvis. Yeah, okay. So what happened was that they sagged down and back. I just want you to sort of flex from your thoracolumbar junction just a little bit further forward for me. There you go, yes. So you moved your head a lot, but the spine went to where I wanted. So now just pick your head up without moving the rest of your body. Awesome. Okay. Now have a feel of your muscles for me, please. Tell me what you're feeling.
Uh, TFL is still fairly firm. Hip flexors are a little more relaxed. Glutes aren't really doing anything.
All right. So it's the TFL that we're trying to get to turn off a little bit. And quite often TFL doesn't like the way that it sits. So this is the posture that I'd prefer you to stand in right now. And it's like minuscule difference. It's minuscule in the amount of difference. Um, all right. What I want you to do is I want you to put your hand or your thumb or your fingers in the back of the greater trochanter, please. Yeah, I reckon just a fraction lower than that, if you don't mind. Yeah, that's it there. There should be a meaty bit back there. Um,
Yep.
all right. Now, at the moment, my suspicion is that it's a little bit hollow in there. And what we want to do is we want to make sure that it's not hollow. We want to make sure that we fill that area out. So just think about, just use your left hand on the hip crease, the right hip crease for me, thanks. The right anterior hip crease, yeah. Okay, I want you just to imagine there's a magnet from your fingers there at the front to the fingers at the back, and I want you to let your body, your hip, sag from the front of your hip back towards the fingers in the back of that greater trochanter. I want you just to think about that for me.
Say that again.
So it's like a magnet,
Uh-huh.
and it's like a force that's going to allow the front of the hip to go towards the back of the hip. I just want you to think about it. I don't want you to move. I just want you to think about it. Now, usually in the clinic, I would have my hands where your hands are, and I would be able to feel and tell you when you get the right reaction. Because you're halfway around the world, it's a little bit difficult to do that right now. So just think about that. Just flex forward just a tiny amount in your posture for me. Thanks, Christy. Yep, that's it. Okay. Now tell me what the TFL feels like as you're trying to get that force from your left hand to the right hand.
Well, I feel like my quad on my right is what's letting go.
Okay, good. Good. Tell me about the TFL. Let go of your hands and feel the TFL. Just don't lose the feeling. So tell me what TFL is doing. ASIS to greater trochanter.
Yeah, it's about the same. I don't know.
Okay, but your quad let go, okay?
Yeah.
So that's good. So we're getting more and more muscles to turn off, which should be relaxed. Like your TFL should not be working hard at this rate. I can't see your feet. So are your feet together or are they apart slightly?
Like 5 inches
Okay,
apart.
so they're about underneath your hips, is that right?
Yeah.
Okay, that's fine. Um, let's just try one more thing. I just want you to think about feeling the weight of your leg, sorry, the weight of your body sitting down onto the toothpicks or the piles or the poles of your legs so that your pelvis sits into the ball of the hip, the femur, just a little bit more deeply. So you're sort of swaying backwards there. Allow that force to flex you just a little bit. Yeah, and from the hips, anterior tilt, just the slightest amount. That's enough. Yeah, even that's a little bit too much. Sorry, there's a time delay.
Yeah.
That's it. Tell me what TFL's doing now.
It's about the same.
That's okay. So what's happening is that TFL doesn't feel like it has the security to turn off at the moment. And I could continue to try some tricks if I was in the clinic, but let's take you down to the ground and try some exercises which will be much easier to do. So I'll just get you to
Okay.
move the camera for me. Thanks, Christy.
Yeah. Is that good?
Yep, that's good.
Okay.
All right, have a lie down on your back for me, thanks. All right. Okay. So I want you to find for me again your ASIS and your greater trochanter. Awesome. Okay. Tell me what TFL is doing now.
Go lay down. You go to your bed. Go to your bed.
Bedtime.
Your bed. Yeah. Yeah, lay down.
He wants cuddle time, Mummy.
Yes, he does. He finds it odd that I'm on the floor.
Huh.
Lay down. Can you lay down? Yes. Go to your bed. The TFL is more relaxed.
Awesome. Okay. Now what I want you to do is have a feel of that greater trochanter, and I need you to follow the bone closely when you move, okay? If you can put your
Okay.
left hand on the ASIS again, that'll be helpful for us, and follow it if it moves as well, okay?
Okay.
I just want you to pick up that right leg for me, please. And put it down.
One.
No, that's good.
Okay.
And go again. Okay. It's really, really slight. What we're seeing is, hold on. I'm trying to draw on you, Christy. Sorry about the phone. Um, draw. Oh, let's try that. That didn't work. Just ignore the phone in the background there. Oh, draw is not supported. That's a shame.
Oh.
Alright, we'll ignore that then. Okay, I want my full screen back. Okay. So what I want to show is that I just want to show that your hip, so pop your right hand on the greater trochanter, left hand on ASIS again. I just want to show that when you hip flex, when you're ready, hip flex, that you spin and then you glide. And there's a bit of a, oh, it's really, really hard to show you. I hope this comes out on the recording. But right through here, so go slow, lift up your leg, slowly. Right about there, stop, stop, stop. Right about there, I wonder if you feel something like a pressure in the front of your hip or your groin. Because right about there, it looks like you're about to start shifting that greater trochanter. It's hard to tell because I don't have my hands on you and I don't see you. What are you feeling right now at this point here?
Um. Hmm.
So go down again and come up and hip flex. Yeah. It's at that point there, there's something. Show me your full hip flexion range and go back down. And I just need to see your pelvis. So I need to, if you can hold on with your right hand to your ASIS and your PSIS, sorry. So right
PSI.
hand, yeah. Can you just hold on to your pelvis, basically?
Yeah.
Okay. Let your hand follow your pelvis. Hip flex for me, please. Yeah. So is your pelvis moving around? Because it looks like it posteriorly tilted.
Yes.
Okay. I want you to stop at the point where it starts to posteriorly tilt for me, please. Yeah. Okay. So the point that I wanted you to stop for your hip was just a little bit earlier than that.
Okay.
And I think that's when the resistance starts. And then you've taken up labrum here, I think. And then you're starting to rotate your whole pelvis. Does that make sense?
Yep.
Okay. So pop that down for me. Now use your left hand in the hip crease, so in the groin or the front of the hip. Now, this is hip flexion. You should be using your hip flexors. What I want you to
Yes.
try and do is try to get like a feeling of weight going down into the floor as if the ball of the hip is going to sag towards the floor without moving your pelvis for me, please. So try that. And when you're ready, you can hip flex. Nice. How did that feel?
Felt good.
You're at the same point. Is that about right?
Yeah.
Okay. So I'd say that's your true hip flexion. Now, what I want you to do is, um, can you monitor that pelvic tilt for me on the other side or whatever with your left hand?
Yeah.
And we'll use your right hand to do the greater trochanter for me, thanks. Let's just see if it's the same left to right. Go again.
You want me to go until I feel my pelvis start to move?
Yeah, yeah, that's right. So hip flexor right again.
Right there?
Yeah. So that's a little bit further, Christy, which is
Yeah.
interesting given that your pelvis um is fused. So come down again. It just goes to show you how much soft tissue is involved as well. Okay. So this time what I want you to do, we'll call that your new one, okay? See
Okay.
where your fingers are in the back of your hip on the right hand side?
Uh-huh.
I want you to think about, as you lift that up, I want you to try and fill that out for me. I want you to imagine that the bone is dropping into the back of your fingers there, okay?
Okay.
Hip flex for me, thanks. How does that feel?
I feel like the hip flexion is more isolated from the pelvic motion.
Awesome. That that is much closer to femoral head centering. So what we're going to do now is I want you to put the one leg down, so the right leg down. I need you to still monitor your pelvis and you monitor your greater trochanter. Now, the it's really hard to standardize the pelvic position and your foot position on the left. So let's just try and get you to put that left leg down as well. All right. Now, what I want you to do is to find that spot. I want you to think about the spot in the back of the greater trochanter. I want you to think about the weight going down into it. Um, Actually, we better do the other one first. So I don't want you to think about anything, just monitor. I want you to think about how heavy your right leg is, please. So lift up that right leg. Yep. How's the heaviness? How's the hip flexor feel? How's the TFL feel? How does the rest of your body feel?
Well, let's see. My pelvis wants to rotate that way.
Mm-hmm.
My hip flexor is starting to let me know that it's working.
Mm-hmm.
That's one of the areas I tend to get my hip pain is anterior hip. Um, the leg feels, uh, I don't, heavy, I guess, but in a normal way,
Okay,
not
good.
unusual.
Just remember the heaviness of that leg. It might feel like it's 1 pound heavy. It might feel like it's 5 or 10 pounds heavy. It doesn't really matter. What we're looking for is change to more heavy, less heavy, or the same, okay?
Mm-hmm.
This time, I want you to lift up your leg just the same amount, so about a foot, maybe a foot and a half. I want you to think about the weight going down through the groin, down through the back of those fingers at the back of the greater trochanter, and then lift up that leg when you're ready. How did that feel?
It felt more controlled.
Uh-huh.
My pelvis didn't rotate. Um,
How did your hip
it felt
flexors feel?
they felt okay. It felt like a little bit more work, um,
More
but
work? Yep. And what about the heaviness of the leg?
uh,
Try
maybe a
it,
little bit less.
try it again. Just so thinking about the hip flexors. Now you did
Yeah.
lift it higher this time, so just a little bit less high. And just to there, that's it. How did that feel?
It felt good. I
Did
think I felt my lower abdominals working more, so
good?
a little bit less of an arch through my low back.
And how's the hip flexors feel?
They didn't feel like anything,
That's good,
which is
right?
good.
Yeah.
Yeah.
Excellent. Look, Christy, I think you've just experienced what femoral head centering feels like. Okay? Now, if you can hold on to that feeling, then we can translate it back into upright because do you remember how your TFL wouldn't turn off just in standing?
Right.
That's the kind of feeling that I want you to develop in standing, is where that heaviness goes towards the back of the hip. I want you to hop
Hmm.
up now and try standing. You're going to have to move the camera again, I think. Okay. So try to keep
Okay.
everything the same. Tell me, take an assessment of your glute activity, your TFL, your hip flexors. Tell me what they're doing.
Oh, TFL's still pretty firm.
That's okay.
Hip flexors also.
Okay.
Glutes aren't doing much.
Okay. Now I want you just to put your hand over your sternum and a hand on your pubic bone. Yep, good. And what I want you to do is to just bring your chest over your pubic bone for me. Just a little bit. That's it. Good. Stop, stop, stop. Okay. Reassess for me, please.
Same.
Yep,
Feels about the same to me. Yeah.
that's fine. Okay. Now what I want you to do is to think about that heaviness of the ball going back into the back of the socket for me. Just like we did on the ground. I know that you can do it on the ground, so we're trying to generate that action in standing now. So maybe use your right hand in the back of the hip to give your, that's it. And try to get those fingers around the front a little bit more. Um, so I think you need to drop your thumb a little bit, about an inch.
Inch.
Yep, that's it back there. And then I want you to use your fingers to try grab the front of your hip. So in the hip crease, right hand in the hip crease. Yeah, kind of like that, if you can. I don't think your hands are big enough. Um, all right, now what I want you to do is to try, yeah, that can work that way. Okay, what I want you to try and do is put the pressure into the back of your hip, where your fingers are. So you might have to pike or flex forward at the hips. That's it. I want you to relax those hips at the back. Relax your bum, your back passage, whatever. Try to send the force from the front to the back. That's a posterior pelvic tilt that I'm seeing there. So allow yourself to flex forwards. That's it. All right, tell me how that's feeling.
How what is feeling?
Glutes, hip flexors, and TFL.
TFL is a little more relaxed.
Okay, good. We're getting there. We're getting there. What I want you to do is just a quarter squat for me with two legs, bend knees, bend hips, tip forward, keep your chest between your shoelaces, okay?
Okay.
Okay, so if you're watching the video later, you will see that she kept her chest behind her shoelaces. So go down again for me, please. It could be parallax error, Christy, to be honest. So I think I need you to raise your hips a little and tip your chest forwards a bit. That's it. Yep. Now, tell me what TFL does there.
Oh, it's nice and soft.
Yeah, okay. Now,
Hip
hold.
flexors are on.
Hip flexors are on.
A little bit, yeah. More than TFL is.
Yeah, so the hip flexors shouldn't be on because passively you should
Yeah.
be a little bit more forward. So I want the weight through the knot of the shoelaces. Can you, it looks like you need to go forward just a fraction to me, but it's hard to tell on video. How does that feel?
Better.
So hip flexors are better?
Yeah.
Just ignore the phone in the background. I'm really sorry about that. Okay. Can you feel your glutes and tell me what they're doing?
They're working.
Awesome. Feel your back and tell me what they're doing.
My back extensors are working.
Good. Okay, you're in the right position. Okay, this is good. Now, feel your TFL again. See how they're soft? They
Yep.
they do not feel threatened right now. Okay, they do not feel like they need to work to try keep your hip in whatever position that you like to be in. What we're going to do is try and find a path to keep the hip in the position that TFL is happy with, okay?
Okay.
So, I want you to stay forward like you are. You probably feel like you're quite far forward compared to what you normally would do. Okay.
Yep.
I want you to try stand up slowly and keep your hip flexors and your TFL activity to a minimum. Stop, stop, stop. You're going backwards. It's,
Oh,
yeah. So, I need you to sort of keep your head where it is, your chest over your feet still, okay? So,
okay.
stand up. So, straighten out your knees, straighten out your hips, and your chest too. So, extend.
Oh.
Stop, stop, stop. You felt your TFL come back on, didn't you?
Yeah, right here.
Yeah, okay, good. Now, at the moment when you bend forward, if you bend forward just a little bit more, you should feel calf, hamstring, glutes, back. Is that about right?
Yeah.
Okay. Keep that feeling. Try stand up for me. Not you're allowed to let the feeling turn down in volume, but I still want that pressure in the back of the hip. How's TFL coping?
Better.
That's all right. That's it. Good. That looks better. Okay, you're almost upright, okay? You're almost there. How do you feel?
Good.
Okay, is TFL working? Is it calm?
No, it's not.
So it's not working?
It's not working.
Okay, good. All right.
Yeah.
Now to come up the last little bit, you really have to focus on that back of the hip feeling, okay? So you're
Okay.
very, very, very close now. So relax your bottom. I need you to stand taller for me without leaning backwards, okay? Yeah, that's it. How did TFL cope?
Good.
All right. You're upwards with a very tiny forward lean, but I will accept that right now. I think you need to sway back an inch only. Only an inch, not a foot. So sway from your
Sweet.
ankles. Ankles. Take your whole body back. Plenty. That's plenty. That's plenty. That's plenty. How does that feel?
Feel nothing changed
Good.
except swaying backwards.
Okay, good. So sway back just a fraction, just a little bit more. That's plenty. That's plenty. That's good. That's good. How do you feel?
The same?
Awesome. I am happy with this posture. Like you're a little
Okay.
bit forward head poked, but that's because you live in a posterior tilt with a slight sway, I think. All right. This is the position that should be your starting position for us to do quarter squats and all your other work. See, because now your hip flexors and your TFL are happy. They
Yeah.
feel
Well,
safe.
the biggest difference that I feel like between how I'm standing now and how I usually stand is at my knees. My
Right?
knees are more flexed than usual.
Okay, well, let's try get your knees to straighten out.
Yeah.
What happened?
Well, the pelvis wants to go posterior and then the TFL tightens up.
Yes. Okay, so the pelvis wants to go posterior. That's the
Hmm.
threat to the TFL, right?
Yeah.
So what I want you to do is we're just going to exaggerate it. I want you to bow forwards like you're bowing to a Japanese man. Awesome. Stay there. Now straighten your knees up. How does that feel?
Fine?
TFL should still be off.
Yes.
Okay. Gently stand up with your legs straight. Come taller for me.
It's good.
Awesome. That's what we call relative flexibility, okay? So what we
Yeah.
did was we took out one end of it, and then your control system can work out the rest. When we try to do it from your knees, because of the way that the brain has patterned that, when you try to straighten out your knees, it wants to posteriorly rotate you at the hips, and you didn't have the control for that. All right, there you are, right there. You're standing tall, your TFL is unthreatened. You can now go to, say, a quarter squat with two legs. So, quarter squat with two legs. I feel like we're in a comedy video right now.
Oh. Okay. Well,
He's all right.
that's
He's
good.
good there. He's good
Yeah.
there.
Yeah.
Okay. So I want a quarter squat. Keep TFL silent. Stand up and get your knees straight. Yeah. Good. And come up.
Oh.
Good. Good. So you stopped, you corrected, and then you went forward. Is that right?
Hmm.
Good. Do it again. I want you to get it. I want you to keep trying to get it until you hit it and you don't have to think about it. Good. And up. See how your brain doesn't know what to do? That's
Yeah.
that's the learning that you got to do, okay? So I think when you're trying to straighten your knee up, I think your brain wants to help by posteriorly rotating you. So
Yeah.
you just have to sort of train it to relax a little bit, and that's going to be your hamstrings and your glutes a little bit, I think. So
Hmm.
try it again and up. Yeah, right. That's it. Good. Good correction because you started to go backwards, yeah?
Yeah.
Now, if you can't get the legs straight, then tip your chest forward, get the legs straight, and then stand up that way. That's it.
Well,
Good. Good work, Christy. Nice. Did you feel that?
yeah.
All right. Try it again. Quarter squat. Up. Think tall. Relaxed. That's it. Nice. Nice. How did that feel?
Good.
Good. Go down again. And up. Hey, that was pretty fast. How did that feel?
That felt good.
Again. Let's go again. Is there any muscles that are working excessively hard right now?
My quads.
Right. So your quads are hard because you're driving your knees forward and not keeping your chest over your feet enough. Unfortunately, the beautiful dog is kind of hiding where your feet are, but we can sort of guess where they are. Okay, so the front of the shin, for those who are watching the video, the front of the shin is roughly where, thank you, is roughly where the center of gravity should be. Your dog just laid down and we can see your feet now. What's his name again?
Harper.
Harper. Is it a girl or a boy?
Boy Harper.
Boy Harper, cool. All right, over you go. So squat. That's it. So as you stand up, think about knees back, bum up, chest up, stand up. That's better. How did that feel?
It's in the very last range that I feel the TFL just firm up under my fingers.
Yep, that's exactly the range that you got to work on. That's why you don't need to do a full squat. You just need to do the quarter squat because you just need to practice that last little bit of range. So navigate it, tell the brain what you want, think about relaxing, go again. You look like you're a little bit, yeah, posterior sway to me. So, yeah, that's better. Oh, that's too far, but that's okay. Try to stand up, try to navigate through. If you can't get it, tip your chest forward, get your knees straight, stand up. That's it. That's it. That's it, Christy. Good, good, good. How did that feel?
I actually feel like I'm standing up straight now. I didn't
Yes.
before. I
That's
felt like
ex
I was a little bit hunched
You were,
and
you
flat.
were. But that's not that important to me because, if we concentrate on too many variables, you don't really focus on the ones that you need. So the more important one to me right now is not where your upper body is as much as where your hips are. The only reason why I had to change where your thorax was because it was affecting the automatic reaction of the TFL. I had to get you centered over your feet first. Okay?
Yeah.
So go down again and up again. Yes, nice. Go again. You're getting better at this, Christy. And
Yeah.
up again. Good. How does that feel?
Feels good.
Nice. Okay, you want to try something really radical and extreme?
Sure.
Quarter squat for me, please, Christy, on one leg, right leg.
Oh.
Okay, so
So,
so as soon as you transferred your weight, it fired up, right?
yeah.
Okay.
Yes.
Your muscles need to fire up to control what's going on. That's not a problem. So it's going to be a little bit firmer than if you're standing there with two legs. I expect that to happen. What I want you to be able to do is to make it so that the firmness is the same all around the hip. Okay? So glutes, hip flexors, TFL. So let's just practice moving side to side. That's it. How's that
Yeah,
feeling?
no, I think everything comes on the same. Yeah.
Good. Good. This is the important part, okay? Because if everything comes on together, then your whole body feels like, okay, I just need to firm up a bit to support the hip. If only your hip
Yeah.
flexors and TFL come on and your glutes don't firm up in the same way, then your body's saying, no, the pressure is coming too far to the front and we need to shut it down and flex. So I want you to realize that hip flexion is going to naturally put your hip back in the socket. And that's why your TFL and your hip flexors want to work so hard if it is coming forward. It's trying to protect you. That's why
Yeah.
massaging them often doesn't do anything. It can, in fact, make your pain worse because most of the time it's a protective mechanism. Okay, so, some people might also say, well, what if a TFL is short? What if a hip flexors are short? Well, then how is it that we can change what you're feeling? If you are truly short, even though we've been going 50 minutes, you haven't had enough time to develop the length in the muscle. This is all about the nerves and the brain and the amount of activity that you got in your hip. So swaying side to side, I want you to sway to the right hand side. Think about the pressure in the hip and then stand on one leg. How does that feel?
Hip flexor turned on a little bit more, but then it quieted down.
Good. And that's just going to be some postural sway that we can see going on there. um, all right, little quarter squat for me. Tell me what happens. Okay, you're very posterior. Thank you. And up. How did they feel?
Um, uh, it's hard to tell.
Okay.
I feel, yeah.
Yeah. I was just going to say, tell me what the hip flexors feel like. Tell me what the TFL feels like.
I mean, the glutes are doing the most.
Good. They should be. Your quads down near your knees should be doing some work as well.
Yep.
Tell me about the hip flexor and the TFL.
What would you like to know?
How's the activity of it when you do it?
Pretty strong. Well, the hip flexor gets a little bit less firm when I get right about here,
Good.
and even less as I go down.
Yep. And that's what it's
Uh,
supposed to do.
TFL is on really strong. The glutes over here are also on.
Yep. And when you think about it, what they're trying to stop you from doing is tipping over to the side. They're trying to stop the hip drop. So I expect
Yeah.
them to work. That's okay.
Yes.
I expect them to
Yeah.
work. Now, what I want them to do is I want you to do a quarter squat. I want you to feel the hip flexor relax. TFL should be working, but it should be just as firm as the posterior hip, so the glutes and the deep hip rotators. And then when you
Yeah.
stand up tall and put that leg down, everything should go back to how we got you to the first place, to this first place, okay, which is relaxed.
Okay.
How did that go?
Not very well.
Tell me about it. Tell
uh,
me about it.
so, so when I was down in my quarter squat, it where I feel my TFL feels a lot more firm than the glutes here. And as I stood up, everything kind of like trying to sort everything out, but it was a lot harder to come. I still don't think I'm in my relaxed posture.
Well, okay, well, let's get you into the relaxed posture. Tip forward at the hips, feel the TFL, feel the hip flexors. So flex forwards like you're bowing. That's it. Get those knees straight. Everything should be soft right now in the front. Is that right?
Yep.
Keep the softness. Stand up tall. How are you going?
It's okay.
Is it good? Are we an effective team? Have you seen
Working on.
Oblivion?
No.
Oh, it's a quote from a movie.
Okay.
That's good.
Yep.
Okay, that's your reset. Okay, so I want you to hit that every time. This is where you start from. You're now going to transfer your weight towards the phone and you're going to keep the activity equal. How does that feel?
Yep.
Good.
Good.
Lift up that left leg slowly. Keep control of that contraction. Keep your chest over your shoelaces, so bow forwards a little bit. Good. And bend your knee and quarter squat at the same time. Keep your chest over your shoelaces. That's it. Good. Come up. Put the foot down and go back to relaxed standing. How does that feel?
Feels good. I got it.
You got it? Awesome.
I got it.
Do it again. Burn it in while you can. Yes, that looks good. Good. How did that feel?
That felt good.
Okay. It's these little subtleties that I want to try and impart on people in their exercise.
Yeah.
Okay. That's awesome. All right. Why don't we call an end to it here? It's been an hour.
Okay.
Um, we can do lots of different things. We can do side lying exercises. We can do, um, isolation type exercises. I can make you quadratus femoris work. I can make you iliacus work. There's all sorts of things that I can do, but really, if you want to walk, if you want to jog, I know you have a 5K jog goal. Um,
Yes.
if you want to do those things, you have to get into upright. And even though you couldn't do it at the start, and I had to get you to lie down to feel what I wanted you to feel, I wanted to show that I can quickly get you back into upright and give you something to work with in upright
Yeah.
because we all spend our time in upright. So um, that's why I really don't like lots of lying down exercise because you lie down only for a certain amount of time a day. And if lying down is your main activity because you're in a lot of pain, well, then for sure, we do lying down things. But if you're up and walking around as part of your day, I really love to work on this sort of stuff in upright. I think it was a great session. What did you think of it? Do you have any thoughts, comments, feedback? Tell us what you think.
It was really helpful. All the cues were really helpful. I think trying to make it happen during my day is the next step.
Well, of course, and this is going to be like I mean that's a very big leap to be honest. But even just the awareness that you can change the activity of your muscles just by thinking about things differently and thinking about your
Yeah.
posture differently. I've given you a reset, so I've shown you how to do it in standing, that you can actually reset it. Just
Yeah.
just changing it gradually, don't go for the okay, my goal is to do the whole day without TFL being overactive. That's just going to be
Yeah.
unrealistic. But
Yeah.
just
Yeah.
go, okay, I'm going to check in every hour. I'm going to set an alarm, top of the hour. I'm just going to check in. Okay, what's my hip doing? Let's see if I can check in and change that when I can. And if you can't do it because you're fatigued or because you're busy or because you're doing something, that's cool because really nothing has changed. So you're not getting worse because you're not doing something different. Do you know what I mean? Um,
Yeah.
so just making a tiny bit of change is still going to be better than the status quo. So even if you just do a minute extra of change a day, I'm totally happy with that. All we're
All
trying to
right.
do is get the brain to calm down, get the brain to realize that there is an option um, where firing up those muscles in response to a threat doesn't always have to be the response that you take.
Yeah.
All right, Christy, thank you very much. I'm
Yeah.
just going to stop
You.
recording now, so I'll catch you on the flip side. Thank you.
Okay. Yeah, thank you.